Hello. Today I'm going to discuss the post-procedure physiotherapy after platelet rich trauma treatment of both knees in Chennai. Platelet rich trauma treatment is otherwise known as PRS treatment. It is indicated for moderate to severe cases of osteoarthritis of both knees. It's a biological procedure and it is done as an outpatient. I teach the patients the initial physiotherapy and I remove the dressings after 72 hours. The recovery of patients is speeded up by special physiotherapy to both knees. So for this purpose, I'm going to take you to the clinic of my physiotherapist in another location. Now I have come to a location in Adyar called Indra Nagar and I am walking towards the physiotherapy clinic. So this is in 8 lane. You can see the physiotherapy clinic, Sri Krishna Physiotherapy Centre, alleviating pain, restoring mobility. Mr. Devarajan, physiotherapist. Meet Mr. Devarajan.
Hello. Hi,
How are
doctor.
you, Devarajan?
Hi, doctor. Good. I'm doing good.
Good?
Good.
How's your day today?
Day has been busy so far.
So far,
Yeah.
I can see I've seen a lot of patients there.
That's right.
Huh?
So I'm actually writing the notes, preparing the notes in the midst of that.
Okay. Have you got any patient of PRS,
Oh well, yes.
post-operative,
Yes.
post-PRS
Your
treatment?
patients have walked in.
They walked in?
They walked in,
Okay,
yes,
good.
sir.
You've seen some few patients now
Yes.
from Singapore recently.
Yes.
What did they have to say? That you're
So they were quite happy with the overall outcome of the therapy which is done here. They came in
So
with
they
stiffness.
informed me also on the telephone.
Yes.
So I thought I would come directly to the man himself and find out what exactly this involves. So we are going to have a one-to-one chat with Mr. Devarajan. And tell me about yourself, Mr. Devarajan.
So my name is Devarajan Subramaniam. I've been practicing for the last 29 years, and I've done my masters in physiotherapy, and I am quite passionate about what I'm doing at my work. And so here I am with patients who seek out my help, people who come in with pain, people who come with restrictive mobility, and of course people who come in with procedures done. And so our job is to alleviate their pain and restore their mobility.
Wonderful. Okay, I have known you for the last
20 years.
20
plus years, yeah.
20 plus years, because in 1999 it started.
That's it.
With an injury to somebody in your family.
My aunt.
Before that itself, and I had known you before that also.
Yeah.
And you used to do the physiotherapy for my TKR patients. That used to be very cumbersome. 3 months of physiotherapy,
Yes.
but now, and lot of cutting and healing and all that. And now this is a much simpler procedure. So let's come straight away to this PRS treatment. You've seen the patients. I've sent them to you after the dressing has been removed, after 72 hours. So when the patient walks into your room, inform the viewers as to what state they are in, and then how do you assess them and how do you take it forward from there.
Okay, thank you. So basically what we look for the patient is as they're coming into the clinic as to how they're walking. So these patients who have had their chronic osteoarthritis and have undergone this procedure walk in with pain, with stiffness and swelling around the knee joint. So what we do out here is to carry out a comprehensive assessment starting from their lumbar spine, hip to toe assessment, to evaluate to see as to where they have got pain, whether the muscles, which of the muscles are involved, what is the kind of the joint line pain, as to where the pain is centering around, their walking gait, how they are walking, whether they are walking the normal heel to toe gait or do they have a difference in their gait pattern, and then we look at their range of mobility and the range of motion of the joint involved. So in the people who are coming with PRS, we look at the knee joint specifically, both the medial and the lateral tibiofemoral joint and the patellofemoral joint.
Good.
And then we look at the kind of effusion that they have, and we also look at the mobility.
There is an effusion.
There is an effusion.
Because there is something injected into the knee joint.
Correct. The knee joint.
Fat and PRP.
Yeah, the knee does look much more swollen. I mean, it does look a little swollen, and then they also sometimes have a difficulty moving Their ability to straighten is sometimes there
because of the effusion.
The ability to bend also because it's a tight compartmental knee. So having made these assessments...
No, one more. Can I just stop you?
Sure.
You might have also noticed some bruising in the thighs.
Yes.
That is because of the procedure.
The stromal cells are being...
The fat
cells are being...
liposuction.
Liposuction is being done on the...
And that is very tender.
Yes, those areas are very tender.
So you address that also.
We address that also.
Right. How do you address all these issues and how long it takes? So I send the patients to you after 72 hours.
Correct.
So what modalities do you have, and what modalities which are the latest modality relevant in this scenario?
Yes, doctor. So the latest modality that we have in hand and which is giving a lot of good results is the extracorporeal shockwave therapy.
What are the results of PRS treatment for osteoarthritis from the knee per se?
It's fantastic. The results are very good.
That is, even if I don't operate, they get better. But I have seen that it is only early cases. Early cases.
Okay.
So the patients which come to me and who have had this PRS are all advanced cases. So the normal course of recovery after a PRS
is usually about 3 to 6 weeks
time. Patient have to be patient.
Correct. No, our treatment does help in
shortening the recovery,
hastening the recovery.
That's it.
We actually help in bringing down the inflammation
in time,
so that they are able to start doing their strengthening exercises even better. So it's like a facilitatory platform to start off this strengthening.
So tell me about this extracorporeal shockwave treatment. It's a big name.
Yes.
Abbreviation. EC. What is it?
ESWT.
Wow.
Extracorporeal Shockwave Therapy is a recent advancement. ESWT. ECSWT.
It's a mouthful.
Yeah, it's a mouthful and it's not as easy as it sounds, no? So,
what is it?
So, it's basically a non-invasive procedure which uses higher resolution ultrasonic waves.
No, it sends shock waves.
Shock waves, which is ultrasonic, basically.
No. Shock waves can be sent via ultrasound or via magnetic stimulation. Two ways.
So, these are shock waves sent to the higher resolution ultrasound, which actually help in bringing down inflammation. The shock waves help in breaking down adhesions, fibrous scar tissue. Normally what happens in people who have got osteoarthritis, they have a lot of fibrous scar tissue formed around the knee joint because of the restrictive mobility, the arthritic changes which have happened inside the knee. So this helps in relieving the fibrous scar tissue and improving vascularity around the region. The primary thing is actually revascularization.
Osteoarthritis itself is going to get improved.
Correct.
So in the scenario of PRS, which is there, acts anti-inflammatory, this acts further and adds to the benefit.
The combined effect, this actually beautifully complements the PRS.
And then what else do you see? You find them, they have a wonky gait.
Yes, they have a waddling gait. And
they have lost the basics of walking.
Correct. They actually are they're spending a whole lot of energy in trying to carry by waddling.
And improper heel to toe is the proper gait.
Yes, there's a problem with the gait. The heel to toe gait is something which we need to
take care of the swelling, you take care of the osteoarthritis,
Absolutely.
you take care of the thigh pain and swelling due to the procedure itself, and you address their gait.
Yes.
How is this done specifically? How many days in a week, and how is it done?
So
how long does a session last?
So we actually this is based on the assessment which is carried out. So we work on the joint. We work on the patellofemoral joint.
So there are specific positions for the kneecap joint.
Yes.
Can you show us
the
kneecap? Just show it. That's a model of the kneecap here. Okay.
So, what we do is we go around. So if I were to take this is actually a specimen of the right knee joint. Seen from the outer lateral vision, the lateral side. So we go about giving the shockwave along the patellofemoral joint line,
like that in the sagittal, in the coronal plane,
and then we also handle the medial and the lateral tibiofemoral joint line
in the same plane, but different area. So we release this out first, and then we move on to the muscles which are connected to the knee joint. Leg straight. So on the inner side.
So the inner side,
Here. This is where the aspiration is done, usually from one incision.
So we release out these areas very gently and then go about releasing out the quadriceps, the iliotibial band and the back the
Back
hamstring
also.
muscle, the medial gastrocs, and the lateral gastrosoleus.
Fine.
So it's a procedure which
How long it takes?
It takes about an hour.
1 hour
It takes
for
1
both
hour.
the knees,
For both the knees.
and followed by
Cryotherapy.
cryotherapy.
Which is
you
cold
have a
compression.
dedicated
We have a
cryo
cryotherapy unit which is very, which is a compressive kind of a system.
compressive system.
Compressive system, and it actually helps.
So how
reduce-
should it be done? Can it be done daily?
So we generally don't do the extracorporeal shockwave therapy daily. We carry out the
So
shockwave
we can't
therapy.
hurry it up.
We can't hurry it up. So we need to give some kind of a recovery time between the two sessions.
Okay.
So we do this typically 3 times a week on alternate days.
Alternate days.
And in
So-
between other alternate day, we work on
You don't lose
stimulating.
time.
We don't lose time. We start working on stimulating the muscles.
Vastus, the inner thigh muscles.
The inner thigh muscles.
To
We
strengthen them.
Yes, we do something called as functional electrical stimulation
Good.
or functional muscle stimulation. So this is a method by which we can actually get inhibited muscles to start working again. And then what happens is the patient gets the confidence, gains the confidence, and is able to do the exercises themselves. And then they are able to
So
walk.
now
So we
we
also
will,
retrain them. Sorry, we also retrain them to walk heel to toe gait.
Heel to toe gait.
Which is a very
so
important
these 3
aspect.
things you have shown. Extracorporeal shockwave therapy. You got a machine, you got a patient.
Yes.
And then you got electrical stimulation.
Yes.
Vastus medialis stimulation.
Yes.
And then the third is the gait.
Yes.
So we will now take a detour to your treatment chamber.
Yes, sir.
And
Please do.
see if a therapist of yours is performing this and capture the actual movements
Yes.
for the information of the patients.
Excellent.
Okay. Now I am walking into the physiotherapy chamber. Hi.
Hi, sir.
Can you kindly introduce yourself?
I'm Gayatri.
Uh-huh.
I'm physio. I'm working here for 14 years.
Very experienced.
So I'm going to show about what are the therapy we are giving
Okay.
to a patient.
What is this therapy?
Is, extracorporeal shockwave therapy.
Ah.
This is the therapy we are using in
So let us see this. This is the
yeah.
Shockwave Pra 1000. Okay.
Yeah.
Right. So what is it got? This has got a
This has got a to the head.
head.
Yeah.
It is connected to the main.
Main and
And-
cable.
Cable is there.
Yeah.
And then you use this gel,
Gel-
ultrasound gel,
Yeah.
and just to show the settings of the machine.
Yeah.
Okay.
Okay. This is how we start. It has programs, manual method, and we can
Speak
use.
loudly.
Yeah. It has 2 methods. One method we are using in manual mode and one by program mode. So both it has condition wise how we treat. We can go according to that. So for ma'am, I'm going to use manual mode. This is how the frequency, pressure and shocks we have set for. So now right now I'm using tier 15 to. So pressure I'm giving for ma'am, frequency I'm giving for ma'am is 7. So pressure according to that, according to pain level.
Okay. So
Okay.
this is the
This is
left
the
knee,
treatment- yeah,
and this is the treated knee. There is a this is a PRS patient. There is a entry portal where the liposuction was done,
Yeah.
and you can see some bruising here.
Yes.
Huh?
Yes.
Liposuction. These are all injection sites. The knee itself is having some effusion,
Yes, sir.
and then you apply the probe. Show me how you
Before
wear it.
applying, we need to apply gel. Okay. We used to handle it like this. Okay. Then I'm going to start. Okay. This is
So
how
you can see the sound.
sounds. Yeah. This is how we used to give.
How does the patient feel? Patient feels no pain.
No,
But sort of
no. Wherever she have pain, she will feel discomfort. So we will reduce the pressure according to that.
Yeah, you will calibrate it according to the patient's level of comfort.
Yes, sir.
Okay. And you'll also do it for this area of hematoma.
No, where the
Discoloration.
is
Yeah.
there we will not give directly.
You don't give it directly?
No,
Then?
we
Okay.
will give it like this. We
Means
won't
that
give that much pressure on
you don't give much pressure.
pressure.
Okay. So in your experience, you've treated a few patients now,
Yes, sir.
last week and this week and
Yeah.
all that. So tell me, what is your experience? How do the patients, how are they doing now?
Past 3 days I have been treating 2 patients with this therapy. They are finding with good results. They have been telling that that pain have been come down with a short period of time. I can feel difference with their pain and the swelling and
They're doing good.
yes, sir.
Okay, so this therapy is given on alternate days.
Yes, sir.
In between days, what do? You give?
In between days, we used to give them faradical electrical stimulation for their knee.
To the muscles.
For the muscle to strengthen the quadriceps muscle, and we will give some exercise therapy for them. After that, we are giving air cast cryotherapy for them. It helps.
And then after that, gait training.
Gait training. Yes, sir.
Okay, so they're doing good.
Yes, sir.
Thank you very much, Gayatri, for helping and explaining this procedure. Devrajan,
Yes.
so you've been treating so many patients. On what basis have you been treating it, and is there any evidence in the literature? Have you got any papers, and can you kindly share the papers with the viewers?
Sure. So there has been trials which have been done, randomized control trials.
Okay.
Randomized control trials on efficacy of extracorporeal shockwave therapy for knee osteoarthritis. There have been papers on this, and how this has been widely used for pain relief and treatment. And over a 12-week period, the comparison between the shockwave therapy and the placebo treatment, and how this has been, the results were more effective versus the placebo treatment. So the studies have really been very supportive of the treatment, with the prevalence of osteoarthritis being so very widespread, and people requiring treatments which are non-surgical, non-invasive in nature. Extracorporeal shockwave therapy in isolation also works, in complementary or within complementary,
Following
the injections of the PRS and the PRP.
PRP and PRS. Thank you, Devarajan, for taking care of the patients and sharing your follow-up and experience.
I thank you for the opportunity given to me and to my team to improve our scope of work.
So
in this new advent of PRS and PRP, biological treatments, the role of physiotherapy has been opened up, and
it's not to be taken lightly. It is to be taken very seriously.
Yes.
So I urge the patients who are coming from outstation
to
to have sufficient time
and go through the post-PRS, PRP physiotherapy required in a very intensive and concentrated manner, so that they get the best outcome out of the procedure. Ultimately, what matters most for all patients is the outcome should be long-lasting and sustained. And what would help them is this follow-up on treatment. And let me take this opportunity to thank you again once again, sir, for this.
Yeah, you're welcome.